My name is Dr. Amos Lewa Movita. I am a medical biochemist, and in this profession I deal with pharmacology and pharmacognosy in this area of COVID-19. The objective of this particular module or topic is to describe the recommended processes and the best practices for home care and patients by healthcare staff and the community healthcare and the family members. We will explain the home and community-based isolation, the most recommended way of how to handle these patients, especially after laboratory confirmation of COVID-19, that they have no or mild symptoms, when they are presenting with no signs of comorbidities, underlying conditions such as lung, heart disease, immunocompromised, etc., that place patient at a risk of developing complications. We'll also look at the access of appropriate beds isolation care. The home or community space where the patient is being isolated needs to be assessed to confirm it needs conditions for isolation. Some conditions need to satisfy, which include appropriate caregivers are available at home. There is separate bedroom where the patient can recover without sharing immediate space with others. The resources for access to food and other necessities available. Ideally, there is a separate toilet and bathroom for the patient away from the entire family and other members. The patient and other household members have access to appropriate and recommended personal protective hygiene, which should be minimum, the gloves and face masks. The patient and other household members are capable and are willing to adhere to protective cautions, precautions recommended as part of the home care or isolation, for example, of respiratory hygiene, cough etiquette, and hand hygiene. There are no household members who may be at increased risk of complications for COVID-19 infection, especially patients at the age of 65 and above, young children or pregnant women, people who are immune compromised or have chronic heart, lung, and other conditions. The availability of a thermometer and a personal cable capable of reading and recording it. Be sure to record or to read through the checklist provided to learn more about the methods to assess a home or community-based isolation. Emphasize the certain procedures. Stay in a dedicated and separate, well-ventilated isolation room with an open window where applicable. Limit movement of in the house and to minimize time spent in shared spaces like the kitchen and the bedrooms. Ensure all spaces are well ventilated by keeping the windows open. Get and wear a face mask at all times. Individuals who cannot tolerate a face mask should use rigorous respiratory hygiene. For example, the mouth and nose should be covered with a disposable paper tissue when coughing or sneezing. Isolation should be maintained for at least 14 days from the date the patient is assessed eligible for home-based isolation and care. The home-based care may be overseen by healthcare staff, community healthcare, and family members.